Hi, my name is Kathryn Molczan. I'm a psychiatric nurse practitioner. I see patients ages 6 and up. I specialize in patients with anxiety, depression, bipolar, and ADHD. I really have put a lot of time and effort into learning about ADHD. It's not as black and white as things used to be. So whenever I'm assessing a child with potential ADHD, it's important to have the parents there and their input as well as the teacher's input, compared to where an adult, mainly I'm just talking with the patient and talking about their childhood, what their life is like now, what difficulties they're having, and kind of how that's presenting and looking to them at this point. I take a very empathetic approach when talking with patients. Whenever they're coming to me, it's a very vulnerable time for them, and sometimes there is a negative stigma when it comes to getting help and seeking help when it comes to mental health. But the more that we talk about it and the more that we actually move forward with seeking care and treatment, I think that helps get rid of the stigma. It's really disappointing when I have a patient come in and they're like, oh, I didn't want to get help for the last 5 years because my family doesn't believe in mental health. Well, once they start seeing me or getting help and getting treatment, they can really see it is important for them and the people around them too. So once we start treatment and medication management, looking at the symptoms that they came to me with and seeing how they compare to before medication and after medication, seeing what still needs improved, things that we can change. If symptoms are changing, does that change treatment? So those are the types of things that I look for. Patients typically are not on medication for their whole lives. I don't want any patients to be on any medication, ideally. So the goal is to get them off the medication depending on the diagnosis. So working with the patient, what they feel comfortable with, dosing wise and medication is definitely important to me. I would say the best compliment that I've received is that I've changed someone's life. It's really reassuring and makes me feel like I'm doing my job when I hear a patient say they came to me and they were really struggling and they didn't feel like there was a way out, and after working with me for however long, their lives feel completely changed, and that just makes me feel like a really good provider.